There isn't much I found, and I only found the Facebook group like 2, 3 months ago. So like I was in a support group for like those that had broken the tib fib um from quite early on, but not for acute compartment syndrome. I didn't find that one until recently. So I just yeah, there's not much, and in terms of like general society awareness and things like that, there's just none. Yeah, I think like I know it is really sensitive and like some things do trigger, but I think that's the reality of it though. And that's the thing that needs portraying the most, that like it's not something that's like it's a condition, you have the surgery and that's it. Like it changes your whole life. So I've got 3 children. My eldest is 15 and she's a competitive swimmer. And I have a 3-year-old and a 1-year-old now. But at the time that this happened in October last year, they were 2.5 and 3 months old. I was home alone. I was home alone with them. My partner was at swimming with the eldest daughter, and I'd taken my 2-year-old to bed. And I slipped on the stairs and I fell down the stairs. But my right leg twisted behind me and it snapped my tibia. No, it snapped straight through. And I spiral fractured my fibula as well.
Mm.
Um, and then yeah, and then I had to, but it displaced, the tibia displaced. My foot was turned outwards and it couldn't be straightened. And I had to wait 4 hours on the floor for an ambulance. And then my local hospital had 13 ambulances backed up already. So they took me to a hospital an hour's journey away.
Mm.
Um, and I went there and then, yeah, I was in a lot of pain. Um, and then, yeah, I had an they gave me ketamine, they pulled it to get it in the right position in A&E,
Mm.
and the back slabbed it. But I was in a lot of pain, and I had an orthopedic surgeon come to see me about 3 o'clock in the morning, um, and sort of say like, you are you in a lot of pain? I was like, yeah. And they said, sort of, right, well, we're looking for a condition called acute compartment syndrome for the injury that you've had, you're high risk for it. So, do you know, if the pain doesn't settle off, they said it should be settling off now that we've got the bone in position. So if it isn't, you need to let us know. And then they came back again about 7 o'clock in the morning, and I was still in a lot of pain. I was on gas and air, and he said, like, is the pain subsiding at all? And I was like, no, it's really not. I said, it's horrendous. And then he was like, right, okay. And he checked my um pedal pulse and things like that. And he said, okay, he said, like, I want him to keep a close eye on you. He said, but we are looking for this. And then he came back again at about 9:30 in the morning. And he was like, are you still in a lot of pain? I was like, yes. Like the pain was not subsiding at all.
Mm.
And he checked my pedal pulse again, and he said it was really thin at that point. So he said to the nurses, he was like, we need this back slab off now. And he got some scissors and he cut through the back slab, and he felt the muscles. He was like, her muscles are really tight. He's like, she's got acute compartment syndrome. She needs to go to theatre now.
Uh,
And within 40 minutes, I'd signed paperwork and I was in theatre.
well,
Like, I they were saying to me, you've got this acute compartment syndrome, you need to go to theatre, you need fasciotomies, we're going to need to do this to save your leg. And I had no idea
yeah.
what that entailed. I was just
Well,
like, okay, I was in so much pain, and they were saying, we need to save your leg. I just was like, okay, and I signed it. I literally had no idea what was going to happen, but
yeah.
I signed it and I did it anyway. There was no time to sort of talk through it and what exactly was going to happen or anything. There was no time for that. And I didn't have any family or anybody else with me to sort of ask those questions either. I was there on my own. So it was just a case of like, yeah, they told me, but I was equally, like I say, I was in a lot of pain. So I don't think I was really processing what they were saying anyway. Told me that it'd be fasciotomies, and he said that what that would mean would be um some incisions either side of my calf to release the fascia and the pressure. Um, and he said like they'd make them as small as they could, but ultimately it would depend what level that they found when I got into theatre. Um, and things like that. So he did explain that it would be deep incisions. He said that they'd expect them to probably be around 15 centimeters
Okay.
um long either side, but unfortunately mine was worse, and some of the muscle tissue had already necrosized, so they had to remove that, and I had to have full surgical debridement of my leg. But because I'd snapped the tibia in the way I had, I also had to have an intermediary nail and 5 screws fitted at the same time. So I had all of it in one operation. I was in theatre for 6.5 hours.
Wow.
Um, and the wounds that I've got, like the scars now, they're about 30 centimeters each. They're literally my ankle to my knee, both sides of my calf. So the accident happened around just after 7 p.m.
Mm.
On the Tuesday evening, and it was around between 9:30 and 10 on the Wednesday morning that the doctor was like diagnosed and sent me to theatre. So it
Uh,
was, yeah, 14, 15 hours. I remember was him coming at those 3 intervals.
mm,
Like I remember like nurses saying, like just putting the head around the curtain saying, "Oh, you okay? Do you need any more pain relief?" kind of thing.
mm.
But nobody other than him actually coming and checking anything. I got to the hospital around 1 a.m.
Yeah.
Um, and he came to see me first around 3, and then he came back at about 7, and then again at 9:30. So like 2, 3 hours. The thing I think what made it worse, and like I wasn't able to sort of speak up and advocate for myself, because prior to breaking my leg, I'd never broken a bone before, so I didn't know if that pain was too much pain, if you know what I mean. So like for me, it was the first experience. So like I think if I'd broken a bone before, and I could have been like, no, this is something else because this isn't normal bone break pain,
Yeah.
then I might have been able to sort of speak up myself before
Sure.
that and being like, there's something more going on here. But because I hadn't, I couldn't. I thought I didn't know if I was just being a drama queen because like was that too, like
Sure.
was that what a broken bone felt like? I didn't know. Once I fell down the stairs, like I say, I was home alone,
Yeah.
and my 3-month-old was in the Moses basket in the living room, and my phone was in the living room as well. So I
Right.
had no way to contact anybody, and my partner wasn't due home for an hour and a half.
Mm.
So I actually had to like pull my leg forward and get down the stairs myself. And then I crawled across the living room to get help. Um so, like, I was able to do that, and I was able to see to my 3-month-old, like, get her out of the Moses basket, cuddle her, feed her. And I stayed in that place on the floor until the ambulance arrived. But the first person that the paramedics sent out was a volunteer. So all he could offer me was paracetamol and ibuprofen. And he was the only person there for the first 3 hours. Didn't send anybody else. He kept ringing up and saying like, we need somebody qualified here because she's in a lot of pain. And like they had to cut my trousers off and sock because my foot was displaced, and he was ringing trying to get further help, but they couldn't send anybody. And then 3 hours in, they sent a qualified paramedic
Mm.
who gave me the gas and air. He saw it and gave me the gas and air, and he radioed through and said, like, I need you he said, like, she's priority 3. He said, but I need this as a priority cat 2. He said, like, she needs to go to hospital now.
Yeah.
And 45, and then it was another 45 minutes before an ambulance came to take me. Um, but even then, they had to secure my leg because it was displaced and everything. They put like I don't know what it's called, but like there's inflatable supports, to stop it moving any further.
Mm.
They put all those kind of things, and then they just they left me on gas and air, and I was still on gas and air right up until being taken to theatre. And I just remember being in so much pain. Like I was just, yeah, I don't remember much other than just being in a lot of pain. And when I got to hospital, they took me to um the x-ray on the stretcher. Um and I remember the nurses say, like, after um they'd done the x-rays, going, oh gosh, no wonder she's on that, and no wonder. And I just remember sitting up a bit and saying, is it broken?
Uh,
Because the responders had said, "Oh, sometimes ligaments pop. It might not be broken," and things
well,
like. I think they were trying to just make light of it in a way. Um, but like, so I remember sitting up and saying, "Is it broken?" And they went, "Yeah, twice." I knew I'd broken it myself, because I knew straight away once it happened, because I heard it. Like there was a really loud snap. I
sure.
heard it, and I was in instant pain. And like when I got to the bottom of the stairs, because I went down the stairs on my bottom, and I tried to stand up at the bottom because I thought maybe it isn't as bad as I think. So I
Mm.
tried to stand up, but it was like all popping in the bottom of my leg near my ankle, and I couldn't stand. So I knew I'd broken it, but I think I needed the verbal confirmation from somebody else. Yeah, the pain was just horrific, I think, throughout. I tried to breathe through it as much as possible until they got me some decent pain relief, but it
Oh,
was pretty awful throughout, really. Even following surgery, it was horrific.
oh,
They left it open for 2 days. And then I went back to theatre again for them to try and close it. And I signed paperwork to say that if they couldn't close it, then I'd go to theatre again the following week for skin grafts,
okay.
to close it. But thankfully, they closed it on
Oh,
the first, on the Friday. So. He, like I say, he kept checking like for the pedal pulse, and to see whether that was still strong or if it was faint. And like when he did ask them to remove the back slab,
mm,
it was because my pedal pulse was faint at that point. And then he got them to remove the back slab, and he sort of like felt the calf muscles and said like there was a lot of pressure there,
got
and
you.
that's how he diagnosed it. Yeah, he did. He was like, well, he said his words were like, he said, right, he said, I'm certain. He said, you've got acute compartment syndrome. He said, it's a condition that where it's internal bleeding into the muscles. He said, it increases the pressure. He said, and without surgical intervention, you're at risk of losing your leg. He said, without wanting to cause any further worry or distress to you, there is a risk of blood clots, which can obviously put a risk to your life. He said, so we do need to take you to theatre as a matter of urgency to try and save your leg. And then he sort of explained like how they do incisions. He said that they usually try to make it 15, a maximum of 15 centimeters, but ultimately it depends what they find once they get in there. And then, yeah, and that's pretty much what he said. And then I had to sign the paperwork and go.
Sure.
I I don't really remember sort of other members of the staff. I remember that consultant, and like I did feel like sort of reassured that he'd continue to come back and to check, and that he was being as um sort of like, I can't think what the word is, but like he was being as thorough as he could be, and he wasn't just leaving it, and
Yeah.
and I felt confident in sort of like in his diagnosis and that he knew what he was doing. My mum was traveling. My mum was traveling to see me and to bring some things for me. Um, when he'd come back and diagnosed and said about me going to theatre, but like it was an hour and 20-minute journey for her to come. So like she was in the car traveling when they said I needed to go to theatre. So I remember sort of signing the paperwork, and I rang my mum when I was going to theatre, and I just said like, I've got acute compartment syndrome. They're taking me to theatre now. Um, and my mum was like, "What's that, Tasha?" And I said, "Don't know, some internal bleeding thing. I don't know." And I remember saying exactly that to her. I said, "Some internal bleeding thing. I don't know." I said, "But I'll lose my leg if they don't take me. I need to go now."
Sure.
Um, and that's what I remember saying to my mum. And she was like, "Right, okay, well, I'll wait. I'll wait until you're out." And my mum, bless her, she sat for 8 hours because I was in surgery for 6.5, and then I was in recovery for just over an hour.
Uh,
My mum's waited the entire time for me to come out.
oh, bless her. Who
Yeah, she just sat there waiting for me. That's literally all I remember saying to her is like, she was like, "What is it?" I was like, "Some internal bleeding thing, I don't know. But I'll lose my leg if I don't go, so I'm going now."
no.
So yeah, none of us knew what it was, but I just like, yeah, in the moment, that's what I remember saying to my mum on the phone. My mum would have been there the night before, like she would have been there earlier, but my mum's terminally ill with stage 4 cancer.
No.
Um, so she was coming as soon as she could, and like I was on my own prior to that because like yeah, she's poorly, but also my partner, like I say, we've got 3 children, so he had to be here with them. So
No.
I had to be on my own.
Oh, right, really? Oh, no. Okay.
So
Uh,
yeah, he had to look after the 3 children. He
sure,
became a full-time dad. So I had the surgery on the Wednesday, and then they had it closed on the Friday, and I was discharged Tuesday evening. I had hospital transport to take me home because I had to be on a stretcher with my leg elevated.
sure.
Um, I wasn't able to put my leg down at all. It was completely elevated. It was in like a half cast, so
Okay.
it was a half cast at the back, and then like just soft at the top and the front.
Uh,
And I was in that for 2 weeks. So I was brought home by hospital transport. I had to be signed off by the hospital physio before I could go home. So I had to use a gutter frame
sure.
um, because I wasn't allowed to weight bear on that leg at all. Because I'd broken it and then had that, I wasn't able to weight bear.
Uh,
Um, So I had to use a gutter frame, and I was signed off as being competent to use that, and then I could go home. But they also made my partner go out and get a bed for downstairs.
uh,
So because I wasn't able to use the stairs for obvious reasons.
yeah, sure.
Um, so I had a bed in the living room for 6 weeks.
Uh,
downstairs, and I had a gutter frame, and then I had from 2 weeks post the operation, I had physio coming out to my house. A and they came out to my house for 3 months, and then I started going to a rehab facility, to help with that.
mm,
Um, and then I had hospital transport that took me to appointments for the stitches and staples out and for follow-up X-rays and things like that. I had to have hospital transport take me to those because I had to use a stretcher. I wasn't able to just get in a normal car. For me and the children, we had, yeah, it was like him and then some like my mum and then some friends that helped us through the time really.
uh,
Yeah. In in Scarborough, it's just me, my partner, and our children.
got you.
Both of our families live away. So my parents are just over 2 hours away, and Jamie's family are 4 hours away.
Uh,
And then our friends are sort of like scattered really because they're from like childhood and uni and things like that. So we don't really have anybody here. We don't have people that we call on in the
mm,
local area. So no, everybody travelled. Everyone that came to help travelled to help. Yeah, no, it's been like in terms of our relationship, it's been really, really difficult. I think he was as supportive as he could be, but without going through things, you can't understand it.
yeah,
And I think it was really difficult for him because he, like I say, overnight he became a full-time dad, and we had a 3-month-old. And up to that point, she'd been exclusively breastfed. She'd never had a bottle or formula or anything. And suddenly, I was an hour away, and I
yeah,
couldn't do anything. And it put a big strain, really. Um, and then once I came home, I needed full-time care as well. And it was a lot. And then sort of I think I've said this to people recently. I think when you say to somebody, I broke my leg, they're like, oh, all right, 8 weeks in a cast, you're okay. But
sure.
that's not what happened to me.
Mm,
Um, and I think people struggle to sort of sympathize and empathize with what I have gone through because they just think I broke my leg and that was it. They don't understand the impact of everything that I went through and like how much it still impacts me now.
sure, yeah,
Like it's it has changed our whole family and our whole outlook and everything because there's so much that I can't do. And so like yeah, it's changed like everything that we can do. So because my my physical abilities now are just are like very limited, very limited. So
mm,
like we wanted to take the children to Disneyland, and we've been there before, with the older daughter, but we it's not possible. Like with how I am and how much I can walk and things now, there's no chance. We can't go to Disney.
uh,
Um, I wouldn't manage it. Um, and like we've looked at going to like taking them to Lapland for Christmas. Again, it's not something that's manageable for me.
mm,
Um, so like it's restricted things, but like even just sort of like some days out, so like even just like some of the local days out that we've done previous summers and things like that. There's some that this year we couldn't do because I can't do it. And it's just like it's changed like I'm still not back at work. I was supposed to return to work in July
uh,
from maternity, and I'm not back at work because I can't do my job anymore. So
uh,
I'm having to go through redeployment because and go into a role that I don't really want to do because I can't do the job that I do want to do. But
sure.
physically, it's not possible for me anymore. So,
Uh,
like, it's changed everything about my life. But before, yeah, so I was a healthcare assistant on a mental health inpatient ward.
okay.
Um, so we'd care for like 20 people, male and female, with mental health conditions.
Wow.
Um, yeah.
So
So like, but it was an inpatient unit, and like I'm not able to do that anymore. It'd be like it was 13-hour shifts, and obviously, those with mental health conditions can be aggressive, physically, at times as well.
yeah,
And with how my leg is now, I can't walk very fast. I walk with a limp. I can't move very fast. But also, I've been diagnosed with complex regional pain syndrome.
uh,
Um, as a result of it all as well, and I'm in like constant pain with it. So there's no way I couldn't manage the length of shift, but I also wouldn't be safe with the
yeah.
patients. So I can't do that role anymore. My baby who's just over one now, she's one in July, she like is our last baby.
Yeah.
Um, and the plan was when I returned from maternity from her was to be seconded to do nurse training, and
Okay.
that's never going to happen now.
Uh,
So it's taken like everything that we had planned. Me some like a 8-week course of CBT, but
okay.
I've had stuff like that before, and it's like for the nature of this situation, it just wouldn't be beneficial. So we've been paying for private counselling.
Yeah.
So like it's not cheap, but we've been paying for that privately because ultimately it's like, yeah, necessary. No, I don't really know like what to do. Like people keep asking me sort of like, what do you want to do for a job now and things like that. And it's just like realistically, I don't know because the jobs that I wanted to do, that like the career aspirations that I've had
Yeah.
right from being a teenager and that I've been doing in recent years, like they aren't achievable anymore. And I didn't sort of have a backup plan in my head, so
Sure.
I don't know.
Uh,
So it's just trying to find, I think it's now trying to find a different path that would interest me as much.
mm,
But that is realistically achievable long term, because at the moment the company that I work for, which is an NHS trust,
mm,
they want to redeploy me into an admin role, and I understand like that's all that they can offer me, but I don't see myself being an admin. I
no.
just don't.
Sure.
Like that is like sitting behind a computer screen taking phone calls and referrals. That's not long-term career for me. It's a social interaction, and it's the and helping people to achieve their goals. So like
Yeah.
obviously working on a mental health inpatient ward, your patients would come in at pretty much the lowest point of their life
Yeah.
sometimes, but then within sort of like 3 6 months, you're discharging them out like with their life turned around, and it's just yeah, you sitting behind a computer screen and referring somebody here and directing somebody there, like it's just not like I know some people work in admin for their whole
Mm,
career, but I think there's so many jobs because they fit so many different people, and
yeah.
admin's just not for me. I do still have good relationships with them, but I
Mm,
think um it's just all changed in terms of like my abilities and what I can
yeah.
manage. So
Yeah.
like so yeah, I think sometimes things that they might have suggested we do before. So like my best friends and things, they've got children that are a similar age to mine, and like we would have gone on days out and things like that before, whereas we have done some, but then they've gone off and done other things that I'm not able to do.
Okay.
So
Yeah.
so like things that we might have done together in the past, this summer, like they didn't invite me, and I know it wasn't sort of like a we don't want you to come, but they knew that I couldn't do it.
Okay.
So it's changed in the sense of like they're aware of my abilities, and sometimes that gets in the way of me being able to actually take part with them. I then feel really conscious, like people think I'm just a lazy parent
Uh,
because they can't
uh,
because I don't have like I don't have my leg out, so people can't see the scars and the problems that I have with my leg. So
sure.
like they don't know, so that like, I feel like they just judge me as being a lazy parent or that I can't be bothered kind of thing. Sort of limits me in like in terms of my feelings with taking them out and things, and like and what I can manage with them. Like I try to do as much as I can, but it it affects me in all them different areas, really. In terms of the diagnosis, I felt like the doctor at the time did as much as they were able to, and obviously under the NHS pressures that there are, like I feel like they dealt with it in a quite quickly, really.
Mm,
Um, I felt like they did as much as they could at the time, and as soon as they sort of diagnosed it, they got me to theatre really
okay.
quickly.
Good.
Um, so they dealt with it really quickly, and after theatre and once I was back on the ward, the orthopedic surgeon consultant, sorry, did come round to my bed. Sort of, it was late evening, so they probably shouldn't have even been in the hospital at that time.
Mm,
But they
good.
did. He came round to see how I was after the surgery and to
Mm,
explain sort of what they'd done and what to expect and things, which I felt like was sort of extra care, if you like, than they
sure.
necessarily needed to do. That I felt like they looked after me as much as they could.
Mm,
Um, I think, and I've seen the same orthopedic consultant at each appointment following because of the break in my leg and stuff as well. Um, so he's done like all my follow-up care.
pretty good then.
Um, yeah, because because of my acute compartment syndrome as well, affecting like the blood to the area and stuff.
Sure. Yeah.
Following it took 6 months for my bone to heal.
Oh, right.
Um,
Well, okay.
yeah, so there was at the 3 month mark there was no new bone growth. It took 6 months for my bone to heal because of the complication of acute compartment syndrome on top. Yeah, so it like all affected each other, if you like. Um, but yeah, I think in terms of the doctors and the care that they provided, they did as much as they possibly could, I think.
Okay.
I think the only things that would probably make things better is that just awareness, like
Okay.
because like when I went to see the physiotherapist, like the physio that came out to my house and the physio that I went and saw in the rehab facility,
Mm,
they had never seen anybody with acute compartment syndrome or fasciotomies before.
well,
It was it was completely new to them. And the person that I saw in the rehab facility had been a physiotherapist for 22 years and
mm,
he'd never seen anybody else. He
really?
was
Okay.
Yeah, yeah, he was really, really interested in it because he'd not come across it before.
Mm,
Um, and like, yeah, I just think it's difficult for others to sort of understand sort of the severity of it, if you like, because there's not the awareness. And because my scars are all but healed on the outside, everyone thinks it's all right now, and it's
yeah.
not.
No, sure.
Um, So I think it's just I think it's awareness for doctors and for like general public really.
Oh, that's good. No, because that's
And
quite.
and and support group, I suppose, like, and more so like support groups, if you like, for those that are going through it, to speak to others that are also going through it, so they can understand, because it's quite lonely when you feel like nobody understands, and you end up feeling like you're dramatizing it or exaggerating it when you're not, but people just don't get it. The consultant, right from after the first surgery and every appointment that I've seen him at, has maintained, like, this is a life-changing injury. Like, you're gonna get some use back of your leg, but it's gonna be life-changing. And he said that right from the word go. But
Mm,
I said to people again recently, like, although I've agreed and I've nodded and I've said, like, yeah, okay, like, at every appointment, I don't think until recently I sort of gravitated and accepted what he meant by that,
uh,
because I think initially when he was saying it, I was thinking, right, okay, yeah, there's going to be some things, but
mm,
and I was thinking that by sort of like a year or so out, I'd have my life back, and that, yeah, there might be some things that are difficult, but ultimately I'd be all right, and that's not the case at all, and I don't think I understood what level he meant.
that-
Nobody just understands. You just don't really know. Like, it's, yeah, like, uh, because I've been going back to them quite a bit because of the pain that I'm in. Like, I'm in
mm,
constant daily pain.
yeah.
I'm now under a specialist pain team, and they diagnosed me with the complex regional pain syndrome.
Mm,
Um, and then now I'm on um a pain pathway with them. So, like, I'm on some patches at the moment that they're trying, and if they don't work, then they're gonna look at doing a spinal cord stimulator to
right.
try and help as well. And it's just like, it's all these sort of extra complications and extra factors that are coming, and it's like I'm 2 weeks off the year anniversary, and I'm just like, for it to still be causing all of this. And people say, like, oh, it'll be better in time, but how much time? Nobody knows. And, like, will it be better? Nobody knows. Like, yeah, like, there's just a good thing to come from it would be just like the awareness, like, for,
Yeah.
like you say, for doctors and for others, because even like my own GP practice, they don't understand.
Mm,
Like, they don't understand why I'm still in pain. Um, One of them wrote a report for a claim that I'd made back at the earlier in the year,
mm,
and he said that I would have full function of my leg, and that I could walk 3 miles and things, and there's no chance I could do that. But he had no understanding. He said, well, it's healed now, and I was like, but it's not though.
oh,
Like,
right.
it's not healed at all. Like, the bone at that point had only just healed, and he was like, "Yeah, well, it's healed. You know to say that it's healed." I was like, "My bone is healed, and
Uh,
the outside scarring is healed.
yeah.
The wounds are healed, but internally, it's not." And one of my friends said that she, like, once Jamie had told her that, like, I'd had fasciotomy, she
Mm,
knew what he meant because she'd seen it on Grey's Anatomy. She
uh,
saw apparently it's on one episode of Grey's Anatomy that
yeah.
they perform one. So she knew because of that. But
Mm,
other than that, no, no.
no.
And I'm like, they need to put it on EastEnders or Coronation Street, and then everybody will know.